Thank you everyone for joining us today. We have another great session of Voices of Healthcare Cloud. We are so excited that you all joined us. Before we get started, we have just a little bit of housekeeping. We do encourage you all to ask questions and participate in the Q&A. So as you noticed, Josh, one of our moderators today, asked everyone to kind of let us know where you're joining today, either what city, what country, or what company you're representing. We'd love to give you a shout out and say hi. This will be recorded. And after the fact, we will post the recording. I had some of you reach out prior to the session and said you weren't going to be able to make it. So if you're watching the recording, thank you so much for grabbing it on demand. Now on to how do we engage in Q&A. At the top right-hand side of the screen, you will see a little question box. If you click that, it will open up a Q&A panel. At the bottom, you'll see it looks just like a regular chat. You can put your name in and type a question, and we will moderate that in the background. We can answer you anonymously or share that with everyone in the audience to see your answer. Sometimes we'll answer those questions in the chat, but other times we will save them for our presenters to answer them live. So if we don't get to you in the chat, please note that's probably because you asked a really great question and we want everyone to hear the answer to that. So what we've all been waiting for, let's go on to the presentation. We are so excited to have Stephen and Mariana join us today. Stephen is Synaptiq CEO and Mariana is a quality and patient safety consultant. Today, they are going to be talking about the machine vision pilot for central line dressing maintenance. And we are so excited about this project and can't wait to see what you guys think about it. All right, Stephen, you want to go ahead and introduce yourself?
Sure. It's great to meet everybody. I'm going to go ahead and pull up my screen here. Just give me 1 second. And hopefully that's working. So yes, my name is Stephen Sklarew. As Shelly mentioned, I'm CEO of Synaptiq, and we're here to talk about a solution that we've been building together. And maybe we'll start real quick with some introductions. I'll give you a little bit of background, then I'm going to hand you over to Mariana. So my background is I've been in the software technology industry for about 25 years. I'm on to my 9th startup, and I've worked at 3 big companies, and I served as a developer, architect, CTO, and VP of product in previous roles. Really excited to be here, and I'll tell you a little bit more about Synaptiq as we go, but let me hand it over to Mariana.
Thanks, Stephen. My name is Mariana Gattegno. I am a quality and patient safety consultant and the founder of Volpini Solutions. I've been in healthcare for a little bit over a decade, working in quality improvement, patient safety, infection prevention, and many other roles throughout my career. I'm as excited as Stephen is to be here speaking with you all. We've got a lot of great things to share with you and looking forward to it.
Wonderful. Thank you, Mariana. So just a quick overview of our agenda here. So we finished the introductions. We're going to talk just a second about Synaptiq and the work that we've done in healthcare. Then we're going to jump right into the solution we built. We're going to give you some background. In fact, Mariana is going to walk through the background on the problem in the industry and some of the challenges on the floor. Then we'll work together on a demo and talk to you about a pilot. And then, of course, if you have any questions, feel free to answer them here in the Teams chat. But also you can contact us at any time. We'll be sharing that information after the webinar. So without further ado, just wanted to talk a little bit about Synaptiq. We're an AI solutions company. We've been in business for about 6 years now, and we're particularly passionate about human-centered AI solutions. And one of the reasons why we're excited to talk to you about this solution today is we've been doing a lot of work in the healthcare industry, partnering with Microsoft and Mariana here on a solution that we think is going to be really beneficial to hospitals. So Synaptiq's been working with about 60 clients. About a third of them are in healthcare, and we work with small businesses all the way up to multinational conglomerates. So been doing a lot of work around data strategy, machine vision, predictive analytics, and intelligent document processing. Great, handing it over to Mariana.
Thanks, Stephen. So before we get into the solution, we wanted to talk to you all a little bit about CLABSI, or central line bloodstream infections. Many of you are in healthcare, and so you know that CLABSIs are a big problem that we struggle with nationwide. CLABSIs are a serious infection. They typically cause prolongation of hospital stay, increased cost, and risk of mortality. And just to put some numbers to that, they're occurring in about 400,000 patients each year in the U.S., resulting in about 28,000 deaths and costing us $2 billion in the healthcare industry. They can occur in one of two ways. You're either looking at an insertion-related infection, which is when you place the central line, or a maintenance-associated infection, which is 2 calendar days afterwards. Approximately 3/4 of the CLABSIs that are reported yearly occur after the insertion window. And so for today's webinar, we're going to talk a lot about the maintenance of those lines, and specifically those central line dressings. Now, although there are many ways to talk through what standard work looks like for central line dressings and maintenance, we want to focus on the clean, dry, and intact concept. So that could mean something different to you. It could mean that you're just keeping it clean. There are different verbiages that each hospital or healthcare organizations use, but we're going to use clean, dry, and intact as a way to a broad umbrella to ensure that our dressings are keeping our patients safe. So after insertion, as you can see on that image on the left, a sterile dressing is going to be placed over the central line to ensure that the entry point into the bloodstream is protected. We want to make sure that that stays as clean and safe as possible. Dressings must be changed at a maximum of 7 days, but typically last an average of 2 to 3 days. Now, if you do the math on that, an average length of stay for a patient is between 13 and 23 days, looking at about 7 dressings, 10 to 20 minutes each. I won't do the math on that, but you're looking at a lot of time spent on changing dressings. One of the components of that is education, and we're going to talk a little bit more about that, but training and education, skills verification, they require hours and they require a lot of staff. I'd also like to mention that with each dressing change, the risk of infection increases. Typically, after the first dressing change, you've got a 3-fold increase in infection risk. So all of that to say that once you place that initial dressing, the insertion dressing, you want to make it last as long as possible. And all of those dressings thereafter, you want them to last as long as possible. So that takes us to our challenges. So I mentioned a little bit about the training and education. We've got onboarding challenges, time constraints. There are, a lot of staffing shortages right now. We recognize that in healthcare. It's something that we're trying to overcome, but the pandemic really hit healthcare and of course other sectors very hard. So difficulty onboarding, you have less preceptors, less time to onboard staff. With locations that have a low census, you've got infrequency of the procedure. So if you've got, a few central lines to 10 in-house and you're not doing those changes as frequently, you're going to have knowledge deficits just because of the infrequency of that procedure. There are time constraints, of course. The ratio of staff to patients is constantly increasing, so nurses are responsible for more patients. So not only does the procedure of changing a dressing take time, but also to go back and document after you've done the procedure. You've done a great job, followed the standard work, and now you have to go sit at your computer away from patient care to ensure that all of that is documented in your EMR. We also see a lack of adherence to standard work and evidence-based protocols. Again, not because staff don't want to do the work, it's because of the other challenges we talked about. Either they were onboarded, their onboarding was quick, they haven't had the experience of the procedure in a little while. It could be various opportunities. And then you've also got difficult sites to maintain dressing. So depending on where your central line is placed, whether that be the internal jugular or femoral or a PICC line, anywhere really, you're going to have different challenges to maintain the dressing, surely because of location. So those are some of the challenges. And I'd like to say that a lot of what we've done in healthcare so far is audits. We look at the medical record. We look at, we go room to room doing central line dressing change audits on, if they're clean, dry, and intact, if the dressing changes following procedure. This falls on your infection preventionists or on your staff themselves. And that is another challenge, is ensuring that everything is being done correctly. So all of this together brought us to seek solutions beyond what has been attempted in the past. And our goal with this new solution is to leverage the power of AI together with the hospital's care teams that are already taking care of patients with the standard work developed that's evidence-based, and combine that with Microsoft applications to help improve workflow and improve patient outcomes. So I'll hand it over to Stephen to talk to you a little about the solution.
Great, thanks, Mariana. So as Mariana mentioned, AI is kind of the center of this, but really, the application that we're going to show you today is built upon Microsoft Power Apps, Power BI, and Teams. And so, in collaboration with Microsoft, we built this concept solution as a way to envision what this could look like in a true hospital setting. And as you'll hear a little later, we're looking for pilots to actually build this out and apply it in the workplace and make it better. Just a little thing about machine vision, in case you haven't heard this term, it's also been called computer vision. This is using technology to identify things in images or video, so tracking objects, detecting objects, tracking activities, and it's being used in a wide range of industries, from construction to healthcare to legal. It's becoming quite an important technology because, for better or worse, we're collecting lots and lots of media data. And unfortunately, a lot of that's getting locked up in closets just for liability reasons and not being used, for analytics in the day-to-day environment. So a little bit about our solution, as Mariana mentioned, a big part of the challenge is onboarding time. So we believe that this solution will help speed up the onboarding time. We believe it will, reduce some of the subjectivity that occurs in dressing assessments. So in addition to a nurse's eyes, they'll have this solution next to them that can also identify potential issues. It can be easily updated to reinforce the facility standards. So perhaps different facilities have different standards, and by using a solution that uses those standards out on the floor, there'll be consistency on the floor, and then it can be customized and fitted to each hospital's needs. So different hospitals have different EMR systems, different hospitals have different numbers of staff, and these types of things can be customized into the solution so it's most effective in your environment. Just a quick thing about the solution, there's really kind of three components of it. First, there's the central line assessment app, and that's going to be using Microsoft Power Apps. Second, there is the CLABSI prevention team. So this is a team that we've set up in Microsoft Teams that will receive alerts when there's potential compliance issues. And then lastly, there's the CLABSI assessment dashboard, again, built off of Power BI. And this also surfaces in Teams or independently, but these are all coupled together to help identify potential dressing compliance issues for patients and care teams. All right, shall we jump into the demo? Great, so I'm going to switch screens here for a second. Hold on 1 minute. Hopefully this will go smoothly. Let's make sure this is the right one. Oh, sorry, wrong one. Okay, so you should be seeing a browser that has Teams in the CLABSI prevention team. I'm going to switch over to the app, actually. Great, thank you. And Mariana is going to walk me through it. I'm going to do the clicking.
Sure, thanks, Stephen. So as a member of the care team, I would have the app on my smart device, whether that be a smartphone or an iPad, whatever you have available. And whenever I need to check a dressing, I would take it out and I would take a picture. So to do that, I'm going to either scan the patient's armband to find their record, or I can scroll through the list or use the search function at the top as well, as you see Stephen scrolling.
Did we lose you, Mariana?
Oh, can you still hear me?
Okay. Yep, sorry.
Okay, so the list is going to come from an integration with the EMR. For the pilot, we're going to have a finite spreadsheet that's uploaded into the system for simplicity, but eventually there would be integration with the EMR. So if we select a patient, Mr. Brewer, let me see, once we click on that.
Sorry, I'm trying to find him. Ah, sorry,
There,
at the very top.
Yeah, I just clicked the first one. Okay, so we can see some general information, right? So we've got the patient's information, date of birth, time of last assessment, last image, as you can see here. So I've got that historical information at my fingertips, and then when I'm ready to take a new assessment, I'm just going to tap the button at the bottom to take a picture. There you are. And then I'm going to take it and submit it for analysis. And in this case, Mr. Brewer's dressing is compliant. Now, in terms of compliance, the solution is currently looking for clean, dry, and intact, as I mentioned. But Stephen also said earlier that we can customize the facility if there are additional standard work components that are required in your bundles. Okay, let's try another one. Why don't we do Mr. Sanford? There we go. So again, tap the button at the bottom. Let's take, there it is. We submitted it for analysis. And this dressing is not compliant. So you can see there's a red square around the non-compliance, and the solution tells you that it's not dry and it's not intact. And then at the bottom, you can see in red, it says CLABSI prevention team has been notified. So once within Teams, you can look at the latest CLABSI dashboard.
Yep, sorry. Taking a second to load. Yep.
Yeah. So you can look at the latest CLABSI dashboard. In this example, we're showing how the infection incidence can be sliced and diced by the number of dimensions. So you've got severity, type of compliance issue, cost. This information would come from a combination of the solution and the EMR system. And actually, Stephen, I don't know that we mentioned to the participants what happens once the image is submitted. Do you want to talk a little bit about what's happening in the background?
Yeah, so as soon as a non-compliant issue is identified, an alert is sent out to a team in Microsoft Teams. In this case, we created this team, CLABSI Prevention Team. And as you can see here, when we submitted that last image that had a compliance issue, it came up as an alert, with the assessment of not dry and not intact. And the thought here is that the care team could then take that and go do further assessment and determine whether there's some sort of remediation that needs to happen or not.
Mm-hmm. So this takes your care team to the next level. So typically when you're looking at CLABSI prevention, or really any sort of infection prevention activities in the hospital, you've got a care team that is either just your IP team, just your infection preventionist, or just your clinicians, or some piece of quality. And so what this solution does, it actually brings all of those pieces together. You have the frontline staff that are participating in the patient's care, submitting images that are meaningful. You then have your core team that Stephen mentioned in Microsoft Teams receiving that data, evaluating it, and providing feedback. So it helps bring together the different pieces that we typically see in infection prevention, and it combines it with technology and allows you to have that feedback and that collaboration between the different pieces of the care team.
Great, so I will cut the demo and we will continue on here. Just switch over now. Okay, just making sure I know what screen I'm on here. Okay. All right, so, as I mentioned a little earlier, what we've built is a demo solution. It's using, Power Apps, Power BI, Teams, but it hasn't been built out fully to be used on the floor. And so what we're looking for at this point is some pilot customers. And as far as the pilot, we're looking for folks that are obviously interested in addressing these central line issues, but organizations that would like to be kind of an early adopter, test the solution firsthand, and actually help design it so it's valuable for their organization, and to establish a leadership position in CLABSI prevention. And so as far as what the pilot entails, there's kind of three main steps. The first is, the organization needs to identify a small team that can kind of work with the setup and training. So that would include determining how to capture images. So, there'll be some criteria on how best to capture images so that they can be processed effectively. Procuring equipment, as Mariana mentioned, whether it's a tablet or smartphone, right? There'll need to be some devices on the floor that they can use to actually capture the images. There'll be some training we'll give them on how to capture the images. And then, one of the core components of this behind the scenes is annotating images, right? So in order to build a learning system, there'll be images that are collected prior to the rollout of the pilot that will be labeled with clean, dry, intact, or other standards that you use. That's where an annotation system comes in place. So once we've got the setup done, then we'll work to collect some initial training data. So again, with this core team, we'll go out, have them collect some sample images of dressings, label those images, and then we'll use those to train the machine learning models. And then ultimately, the tail end of the pilot will be about a controlled use. And when we say controlled use, we want to kind of keep it within a small group of people, kind of learn how it's working, not working, make improvements. And, as Mariana mentioned, kind of keep this isolated, like not focused on integrating with the EMR yet, because that adds a lot of complexity, but really kind of make sure the solution's adding value on the floor before kind of moving further. So we envision this entire pilot process to be about 6 months, 3 months in setup and collecting training data, and 3 months of using it on the floor. And so if you're interested in learning more, we set up a QR code here. So if you want to, snap a photo of this QR code, it will send you to a landing page on Synaptiq where we share more information. We've got a white paper we put together. You can sign up to collect more information, even register for the pilot. But we're really excited to hear from you and look forward to answering some questions here today. Thank you.
And Stephen, if I could just add for the group, this solution was really created with the clinician in mind. And so it is meant to only facilitate adhering to the standard work and not add any additional steps to an already busy nursing schedule. So I think that's a really important piece to bring up, that it's meant to make the care team's workflow much simpler and be able to capture all the information. That way you can look historically and see the trends over time in that dashboard that we showed. And it's meant to really marry very nicely with the standard work that's already developed at your hospital.
Great.
Hey.
So yeah, we have any questions?
Yeah. Hey, Stephen, Mariana, thank you so much. We do have some questions. I'm trying to think of a good order to put them in. I think there were a couple around the model, and one of them came in, Stephen, kind of before you went through the pilot kind of phase. But people are kind of wanting to know about how many images is it taking to kind of get that model started? Is it 10, a dozen, 100, or 1,000? Just, I think, a rough estimate is what people are looking for.
This is a very common question in any AI project. And I guess the way that we answer it right off the cuff is say, you really need to start with hundreds and train models and learn how effective those models are. And that may, dictate, getting more. The overall goal is to generalize the model so that it can recognize the correct output given a wide range of images. And so we usually start with hundreds, train the model, test it out, and then we may need to ramp up to higher than that.
Okay, awesome. Hundreds. That's a good number to understand. And then there's kind of a follow-up there. is the AI able to learn over time? And can you kind of tweak it or customize the machine learning to facilitate like specific, kind of like Mariana was saying, specific standards of work? If there are certain things that you learn through the model, can you then tweak it to be kind of better over time?
Yeah, so two answers to that. First is, the solution is designed to have a human in the loop of the process. So I mentioned a little earlier this concept of annotation, labeling images. And the reality is when you put an AI system into production and you start having people interact with the model, some cases the model guesses wrong, right? And it's really important to get that information back to the human to figure out, okay, what can we do better to make the model understand, the real world? And so there is this very important partnership between, a healthcare specialist and the machine learning model that is an iterative process and will kind of improve the accuracy over time. The other part of the answer is that machine vision is fantastic at finding things that humans don't see, right? So as you deploy the solution in your environment and we start seeing how it's working and collecting data, we may find that there are other things that we don't even know about that have correlations to infections. And so that's what's really exciting here, is that by coupling kind of an initial system built around dry, clean, and intact, and looking at data over time, the system can learn how to identify new things that may cause problems. And so, I think the core of our solution here is really this evolution of learning, and it can be both data-driven and human-driven.
And to add to Stephen's point, so we are capturing this images. The AI is becoming smarter kind of over time. And you're also getting a historical baseline of the patient. And so if, like Stephen mentioned, if we are looking at other components that could potentially give us signs and symptoms of infections earlier. So if you're looking at redness at the insertion site in an image from today that wasn't there yesterday, that could potentially help us identify infections sooner, treat patients sooner, and prevent adverse events from continuing.
Well, isn't that the dream? I hope that this does produce those types of results, because that's what I think everybody is looking for. We have another follow-up kind of to the model. Are you offering any kind of like confidence rating, or could over time, once those human intervene to verify that the model is identifying it properly, is there any kind of reporting on confidence of what the model is predicting in those images?
Yeah, absolutely. Yeah, and that's a big part of rolling out these AI solutions, is to kind of validate them before they go out live and then continue measuring confidence or accuracy. And so while we didn't, present this in the demo, that's certainly part of, the solution that we're offering is being able to draw out how much data we need in order to get to the confidence level that we think is workable. But I think what's important to note is that we don't want, healthcare practitioners relying on this as the only answer. It's really a support tool. It's really to help, the care team, do their jobs more efficiently, support their needs, give them data to help them make decisions quicker. And so, we anticipate that over time, the confidence will become greater and greater, and we'll explore new areas where this solution can help, but it's not really a replacement. It's really a support tool.
Awesome. Okay, I'm going to move on to kind of a different line of questioning, and these might be a little bit more for Mariana. A couple of questions around kind of, you mentioned you didn't want to take the clinical worker out of their flow of work. Have you seen this implemented anywhere, and how is it adhering to their flow and not being something new or different or difficult for them to accomplish?
So, of course, whenever you have a change in process or procedure, there's always a time to adapt to it. So, although we would be adding an additional layer, we're hoping that it's going to help the clinician. We have not implemented anywhere, as you all saw, as Stephen spoke to, we're looking for pilot facilities to implement this to, but it was developed in partnership with clinicians. And so whenever you're looking at a patient safety or quality improvement initiative, that multidisciplinary team is really your most important component. So we had frontline staff, we had ICU staff, physicians, quality improvement, patient safety. We had a very robust team during the very early stages of this probably about 3 years ago, right before the pandemic. And we had various sessions where we looked at how can we create this solution so that it doesn't disrupt the workflow. Will it be a little bit different? Yes, of course, because we're adding something to it. But like we mentioned, seeing the infection sooner, providing training and education. So as you get better at doing those dressing changes and they're adhering closer to those 7 days, you're no longer having to do that procedure as often. So it serves as an education and training tool. And then eventually, my dream, and I've spoken to Stephen about this as well, is that when you snap that photo, maybe in the future it could document for you too, so that you're not being pulled away from the bedside from taking care of your patients to be in Cerner or Epic or whichever EMR you're using to document exactly what you just did. So of course, that's future state. We're looking right now just at identifying clean, dry, and intact dressings, but we're hoping that it's going to become just a regular part of the clinician's workflow and not add any additional stress or complication to it.
You mentioned a multidisciplinary team. I could even see this in the future going into kind of a multidisciplinary huddle board as something that, the care team, could have, whether it was clean, dry, or not, to be able to make sure they hit that in their rounds for the next time around. So yeah, very awesome.
And a lot of those, all critical care, most critical care units already have multidisciplinary rounds that are occurring daily. We are seeing a lot of hospitals moving towards a standard work for report out for central lines, not only the indication of why the line is still in, but also what the line looks like if it's in good shape, including that clean, dry, and intact. And so absolutely, Shelley, that directly brings together what we're seeing at the bedside, the report out to the physician, and the collaboration of that care team. So yes, absolutely.
Awesome, Stephen. Actually, do you mind putting that QR code back up on the screen in case people missed it? Let's just leave it up there for a little while.
Okay, yeah, that's a good idea.
Okay, let me look through these questions. Josh, I don't know if you've seen any that I might have missed.
Let's see. So I think one question, I don't know that it was explicitly answered, but as they get into the pilot, we talked about some of the logistics, but what is the time required to kind of get up and running, from a software standpoint, assuming if they've got the licenses or the technology, that they need, they've got the devices and everything else, then what does it look like for them to get up and running with something?
Yeah, so the time frame, our expected duration is about 3 months. Obviously, that depends on a number of things. Kind of the key ingredient of that work is going out and collecting those initial training images. So again, a couple hundred images, and then working with one or more people to get those images labeled to train the system. That tends to be the hardest part to get done in any organization where we do AI. So depending on how dedicated your staff are, that would kind of determine how quickly we can get through that setup and configuration stage. Beyond that, our goal is to spend 3 months, having you use it on the floor. And, as Mariana mentioned, we tried really hard to make it frictionless in the existing workflow. But we suggested a time frame of 3 months as a good period of time to kind of run through it. So again, 3 months to set up and configure, 3 months to actually use it in the pilot, and the setup and configure could be significantly accelerated if you have more dedicated staff to collect and label data.
Perfect. I think, no, great answer. Appreciate that. Shelly, do you have any other questions?
I think that we've gone through the majority of the questions, Stephen, Mariana. I guess I wish we knew if people were clicking the QR code, but it sounds like we have some people interested. They're asking questions, and so I'm really excited to see what comes of this. I guess any last minute kind of comments or things you want the audience to hear, and to the audience, any last minute questions, please go ahead and post them in now.
Yeah, so while we're waiting for more audience questions, I'll just say that we're in the early stages of this solution. So even a conversation that is not focused on doing a pilot today is incredibly valuable for us. So if you have stories about central lines or standards that you're using that are different, or challenges that you're facing in your health system that we haven't talked about today, we would love to hear from you, because we want to make this a nationwide success. And a lot of that comes from understanding all the different various permutations out there in the unique healthcare world.
Awesome. I think it's a great illustration of the creativity that is just potential creativity that can come to fruition through these different technologies. I mean, kudos to you, Stephen and Mariana, for putting in all this work and creating a really cool, impactful, and needed solution. Let's see, we actually got one more question here right at the end, and it is they're wondering if there's any data on similar software that currently exists on the market, anything else, that can be an alternative that you're aware of for this scenario.
Mariana, you want to take that?
I do not know of anything off the top of my head. I think there's plenty of information out there, and Stephen may be able to make some recommendations about the benefits of machine learning and using AI. The combination of bringing that into healthcare is very new. I don't know of any other solutions that have brought together infection prevention and technology the way that we are.
Yeah, I mean, I'll just say, as an AI solution provider, I mean, we're doing work like this in ultrasounds related to identifying plaques and vascular age. We're doing this work in MRIs, to identify potential reherniations of discs after surgery. So it's definitely becoming a common theme, but we hadn't, experienced or heard of anything related to central lines prior to meeting Mariana and talking with Microsoft, and we think it's just an exciting opportunity to make a difference.
Perfect. Awesome. Well, I don't think we have any more questions. So just before the last people drop, I'm going to copy a link and kind of post it for everybody to a form that you can share within your organizations if you would like, but that form is really just one thing, asking for an email address, and it puts people on sort of the email list for these sessions moving forward. We have a session coming up here in 2 weeks that is going to be focused on healthcare analytics, and then 2 weeks following will be sort of a deep dive on virtual health. And so hopefully 2 other great pieces of content to follow up this awesome session. So something to look forward to. But Mariana, Stephen, thank you so much for all of your time today. We really appreciate it.
Thanks for hosting us. This was great.
Thank you all.
Yeah, thanks guys, and hope to see everybody back in a couple of weeks. Have a good one.